Hello everyone, I am Dr. Saranya Rajendran, working as Assistant Professor in the Department of Biomedical Engineering at Sri Ramakrishna Engineering College. Today I am going to talk about a very interesting and rapidly evolving topic, integration of biomedical devices with IoT for telemedicine. This is a part of our course 20 BM 213, Principles of Telemedicine and Mobile Applications. Through this session, you will understand how modern biomedical devices, when combined with IoT technology, have transformed healthcare, enabling doctors and patients to connect beyond hospital walls. Before we begin, let's quickly recall our course outcomes, which has CO1 explains the basic principle of healthcare in telemedicine. CO2 understands the concept of technology, security and standards in telemedicine. CO3 understand the application of healthcare telemedicine. Our topic today will mainly cover the first three outcomes, especially focusing on the technological integration and application parts. These are the contents to be covered today with the introduction, biomedical devices, role of IoT, system architecture, benefits, challenges, applications, future scope and conclusion. Now let's start with the introduction. The term telemedicine simply means providing medical services remotely. It allows doctor to diagnose, monitor and even treat patient without requiring them to be physically present in hospitals. In recent years, the Internet of Things or IoT has played a major role in making telemedicine more efficient and intelligent. IoT connects everyday medical devices such as sensors, wearables and monitoring equipment to the Internet, enabling real-time data sharing and communication. This integration has brought a revolution in the healthcare systems. It improves accessibility, especially for patients in remote areas, reduces unnecessary hospital visits and allows doctors to deliver personalized and continuous care. So in simple terms, telemedicine plus IoT plus biomedical device is smarter, faster and more accessible healthcare. Biomedical device in telemedicine are the core components of any telemedicine system. Let's explore with their different types and roles. The wearable devices, these are compact, user-friendly devices worn on the body such as smartwatches, fitness bands and portable ECG monitors. They measure vital signs like heart rate, oxygen saturation SpO2, sleep patterns and physical activity levels. For example, a smartwatch can detect an irregular heartbeat and immediately alert both the user and their doctor through a mobile application. Such devices are crucial for early diagnosis and prevention. Second, it is the diagnostic device. These includes blood pressure monitors, ECG recorders and glucometers. They capture critical health data of the patients and send it to a cloud server for analysis. This data which helps the doctors track the patient's condition over time and make informed decisions. Third, it talks about the therapeutic devices. Examples are insulin pumps, ventilators and infusion pumps. These can be controlled remotely, allowing healthcare professionals to adjust the dosage or therapy parameters without needing physical presence. Such systems have improved home-based care, especially for chronic disease management. Lastly, portable imaging devices. These include digital stethoscopes, portable ultrasound scanners and dermatoscopes. They allow doctors to perform examination remotely with higher accuracy and share diagnostic images instantly from the expert review. In summary, when we talk about the biomedical devices which acts as the eyes and ears of telemedicine, collecting and transmitting essential health data for continuous monitoring and decision making. The role of IoT in telemedicine, how IoT fits into this ecosystem. IoT acts as a connecting bridge between the biomedical devices, doctors and patients. It helps in collecting, transmitting and analyzing data in real time. Let's break down the process into 4 stages: data acquisition, data transmission, data processing and remote access. In data acquisition, sensors attached to the biomedical device continuously measures physiological parameters like blood pressure, ECG signals, glucose levels and oxygen saturation. In the data transmission, all these data once collected is transmitted through the wireless technologies such as Bluetooth, Wi-Fi, Zigbee or cellular networks like 4G and 5G. The choice of communication protocols depends on power consumption, range and data speed. Data processing: after the transmission, the data is processed on cloud servers or edge computing systems. Here, advanced algorithms, often using artificial intelligence, analyze the data to detect abnormalities or predict potential health risk. Lastly, in the remote access, both doctors and patients can access this processed data through secure mobile or web applications, enabling timely interventions and better decision making. So, this IoT ensures that patient data travels seamlessly from the device to the doctor in a secure and efficient manner. Next, to understand the technology better, let's go through the system architecture of an IoT based telemedicine system. It typically covers 4 main layers: sensing layer, network layer, processing layer and application layer. In the sensing layer, it includes all the biomedical sensors that collects data from patient's body such as temperature, pressure rate, blood pressure and glucose level. Next, in the network layer, the sensing layer connects to the network layer, which uses the IoT communication protocols like MQTT and HTTP. This layer ensures that data is securely transmitted to the cloud storage or processing units. Next comes the processing layer. This is where all the data is stored and analyzed using the cloud servers or edge computing platforms. Artificial intelligence and machine learning models can analyze patterns, detect early symptoms and even predict disease progressions. Last, in the application layer, includes the telemedicine applications, dashboards and electronic health record systems. Healthcare providers can visualize the patient data, generate medical reports and make informed clinical decisions. So, this entire architecture ensures a smooth data flow from sensors to the servers to the doctor's screen. Now, let's discuss why this integration is so important. Continuous monitoring: the patient's health parameters are continuously tracked even when they are at home. This ensures timely intervention in case of any abnormalities. And the early detection: IoT enabled alerts notify the doctors immediately if critical reading cross safe thresholds, preventing severe complications. Cost and time efficiency, which reduces the number of hospital visits, travel expenses and waiting times, making the healthcare more affordable. Personalized healthcare, where the real-time data helps the doctors customize treatment plans based on the individual patient needs rather than general assumptions. And the improved rural access: telemedicine powered by IoT bridges the gap between urban hospitals and rural communities, ensuring equal access to quality care. Challenges: of course, every technology comes with challenges. Here, the data security and privacy, which since the patient data is highly sensitive, it must be encrypted and protected from unauthorized access. Interoperability issues: different devices often use different standards, making integration difficult. Universal communication standards are essential to overcome this. Network reliability: stable internet connectivity is crucial for real-time data transmission, especially in remote or rural areas. Power consumption: wearable devices used need to be energy efficient to support long-term use without frequent charging. Regulatory compliance: healthcare devices must adhere to the standards like HIPAA or ISO to ensure data safety and reliability. IoT-based telemedicine systems are already transforming various aspects of healthcare. Here, some of the key applications are included, like chronic disease management, where the continuous monitoring of conditions such as diabetes, hypertension and cardiac disorders are done. Post-surgery recovery, where a patient can recover comfortably at home while doctors monitor their healing process remotely. Elderly care: smart sensors help in fall detections, emergency alerts and tracking of vital signs for senior citizens. And in the pandemic responses, where the telemedicine proved extremely useful during the COVID-19 pandemic by reducing hospital crowding and limiting infection spread. When it comes to the future scope, looking ahead, the possibilities are vast and exciting. Artificial intelligence will become a crucial part of predictive diagnostics and automated clinical decision making. 5G networks will make telemedicine more responsive with high speed, low latency connections. Blockchain technology will bring secure, transparent and tamper-proof medical data management. Digital twins, virtual replicas of patient will help simulate treatment responses before applying them in real life. The integration of biomedical devices will continue to evolve, making healthcare smarter, more connected and more patient-centric. To summarize, the integration of biomedical devices with IoT forms the backbone of modern telemedicine. It enables remote, continuous and personalized healthcare, bridging the gap between patient and healthcare providers. This technology not only improves the quality of care but also makes healthcare more accessible, affordable and proactive, ensuring better health outcomes for everyone. Thank you all for watching this session on the integration of biomedical devices with IoT for telemedicine. Stay curious, stay innovative and start exploring how the technology can transform the betterment of healthcare. Thank you.